Spend 55 minutes focusing on the problem and 5 minutes focusing on the solution. Never in my life did I imagine I'd be working for a software company. My solution, my software, my company, my product, whatever it may be, really made a difference in the life of somebody. That feels great. As clinicians, we really want intelligence. As every good startup knows, and as every good entrepreneur out there knows, that's the hardest part. Entirely different perspective and appreciation for what founders and what startups are going through. Healthcare is a privilege.
Hi, before we actually start, I'd like to remind you to subscribe to our channel and share this video among our amazing digital health community. And I'm happy to introduce our today's guest. His name is Ryan Vega. Hi, Ryan.
Hey, how are you?
Good, how are you?
Good.
Let's start with your short intro. Can you tell us briefly, lead us through your career path up until now?
Yeah, it's been a journey, so to speak, and I'm sure many of the viewers have similar experiences with many chapters and lots of left turns that came from out of field and ending up in a lot of places that I didn't fully expect. But went to medical school, interestingly was really interested in doing physical medicine and rehabilitation. Had a lot of personal experience with rehabilitation as a patient myself, and so sort of felt drawn and compelled, but was encouraged to go into internal medicine. Found myself at Richmond, did my training at Virginia Commonwealth, and there really kind of came into my own, both as a clinician and understanding what I wanted to do professionally in healthcare. Ended up being very fortunate and finding a home as a chief medical resident, and particularly a chief resident for quality and safety in the Department of Veterans Affairs. That really catalyzed my career in the VA, in which I spent almost a decade. And was really fortunate to serve in various different roles. And interesting how sort of my journey or my chapters are filled with personal loss, failures, both sort of unique failures, but failures of my own volition, and having to sort of overcome adversity in a lot of different ways in which I really found myself compelled to make the system better, and started out in healthcare quality and safety, then found myself in technology and innovation, and then sort of found myself working for a software company. So when I take a step back and look at it, I kind of can see how it all pieces together, but certainly when I'm standing there facing everything going forward, it seems sort of, where did this come from and how did I end up here? So that's kind of been, my journey, and really it's been one of both, I think, professional growth and exploration, and one of really just being committed to that mission that I really want to improve the system and leave things better than I found them.
That's really amazing. I'd like to stop for a sec on your experience at the Department of Veterans Affairs. I just learned recently that VA department is actually one of the pioneers in adoption of healthcare innovation. How did that happen? Why specifically this department?
Well, I think there's two reasons. And so I always talked about the mission of the VA. And one of the unique aspects of the mission of the VA is that if you read the actual statement, it's to care for. And I think that's really important because it's not just to provide healthcare. It's this idea that we in this country, in the US, believe that it is a sacred obligation to care for these individuals, for those that have borne the battle, so to speak. And I think there's another reason too, and that's the way that the system's set up. It's truly an integrated system. There's some ease in which that the payment structure is set up, that the commercial sector finds unique challenges or pressures that doesn't fully allow them to invest in the way that the VA may. And specifically, the ability to have a more longer horizon in what we call value realization. And so while people think of immediate ROI or the pressures that an insurance company or health system may face to see more short-term or immediate ROI, the VA can take time to really allow something to mature through the system and to have the luxury of having a year or two or even longer to show real value realization over time, managing a population and sort of being committed. But I think from my personal experience and sort of the thing that I woke up every day just being really enthusiastic and sort of in awe was, it's the people. Wherever you go, anywhere across the country, and even some of the areas outside of the continental US that are serving veterans, these are people that are waking up every single day, committed to the mission of serving the American veteran. And I think that's what made it special. And I think that that blend of unique mission orientation and some of the attributes that the system allows you to innovate truthfully really creates a fertile ground for just amazing innovation. So that was my experience, and I think it's true. I'm still very proud of the work that we did and love to see VA's continued success.
That's really cool. I also know that you created some sort of like internal accelerator among the employees of the department. Can you elaborate on that a little bit, and what are the results? Are there any successful solutions happen because of that?
Yeah, there's a lot. So I give credit to the teams that really pioneered a lot of this work. There's a number of different components of the VA's innovation ecosystem. There's an office actually called the innovation ecosystem. There's the innovators network and the diffusion of excellence. Both of those are really geared towards different stages of the innovation life cycle, but really they have one profound, I think, impact, which is investment in the individual employee or the frontline employee. It's this sort of belief that those individuals are so uniquely and well positioned to solve some of the challenges that they face every day, that when we give them the resources, that when you give them the opportunity to make a difference, they do. And so you can look at a lot of examples of successful stories, innovations that started from early ideas that are now used by the agency to do anything from scheduling appointments to text messaging platforms that enable better care experiences, to the way that the care is delivered or experienced, anything down to a clinical change or maybe a clinical checklist to reduce non-ventilator associated pneumonia through a project called HAPPEN. So lots of examples, and really just a testament to the individuals who I think pioneered a lot of that work, and to the agency for recognizing the importance of investing in the frontline employee and then bringing the voice of the veteran forefront. So, and those programs are still going strong today. My former colleagues are still doing amazing work, and love being on the commercial side now, watching them and continuing to cheerlead them on.
So you kind of experienced that startup ecosystem working for government, and now you switched to work for actual startup.
Yeah.
So tell us more about Vantiq.
So an interesting journey, and I sort of kind of go back to the things that come out of left field. Never in my life did I imagine I'd be working for a software company, much less responsible for a global market or a global startup. But again, I sort of think about things as chapters along those journeys, and everything that I learned, everything that I gained from losses and failures sort of kind of led me to this point. And what was really compelling about Vantiq is the founders had a mission. The reason that they started the company was to make the world operate better through technology. And it wasn't approaching, I think, problems in a very solution-oriented fashion. It was understanding that a new way of tackling problems was going to be needed. Now that resonated loudly with me. I always talk about, when I give advice to founders or individuals that are starting companies, I say spend 55 minutes focusing on the problem and 5 minutes focusing on the solution. That was something a good mentor had taught me, and so I passed that knowledge along. But it's really important to think about the enabling capability of a technology and how you approach solutions and solution creation differently by solving problems. And that was unique because this wasn't a company that said, look, we're going to build this or we're going to solve this problem. It said, no, we want to make the world operate better through technology. And in order to do that, we're going to have to fundamentally change the way that software is developed. And they had this true belief that that was something that they could solve. And so I think I was drawn to the mission, similar to the way that I still get excited about talking about my experience at the VA, was that mission. So that was the first thing that was compelling. The second thing is I had never seen software like this before. I had never seen a platform that truly did what they had built, and certainly saw immediate applicability to healthcare. This was a market that they were getting pulled into, and they were interested in really going into this with a degree of, look, we think we can solve a lot of major problems, not just in the United States, but globally, in the way that our technology can help advance both healthcare inside the hospital and outside the walls of a hospital. So that was sort of the introduction, was getting that. And then unbeknownst to me, you have these conversations, and I always try to say yes to new opportunities. Didn't think saying yes was going to lead to a full-time offer and all those things, but certainly it was an interesting foray into the commercial space. And now, 6 months into that journey, entirely different perspective and appreciation for what founders and what startups are going through.
Amazing. Can you try to explain? I know it's not a mobile app that you can easily explain to an audience, but can you try to explain in a kind of simple way what does the solution do?
Yeah, the way that I think of Vantiq is it's truly an orchestration engine, and for putting it into sort of terms that I tell my wife or my mom or dad, because they look at me like I have no idea what I'm talking about. Think of it as a digital nervous system. So if you were to touch a hot stove, you would immediately pull your hand off because you would sense that it was hot and that it would hurt. There's a lot that's happening there. There's a lot that's going on. In some ways, you could think that there's cloud compute and edge compute. In some ways, there's a full orchestration. There's things that have to happen for you to pull your hand away. When we think of real-time complex systems, the big challenge is that you have all of this information that's being proliferated or produced. Predominantly now it's being produced everywhere, and that includes on the edge, that includes on your device, that includes your Oura Ring, your watch, your computer, et cetera. So software is running everywhere. Devices are producing more and more data. And the number one challenge is how do we make sense of that world as humans to where all of that information becomes not just data, but actionable intelligence, and then acting on those situations in real time in the same way that you're able to pull your hand off when there's a situation of interest, an opportunity, a threat, or wherever it may be. We want systems to be able to react that quickly or help us react that quickly. And that's, in a lot of ways, what Vantiq is. It's this really unique orchestration engine that has a number of other components. It has the agility and rapid development to build those types of systems. And it does so in a way that thinks about the mission critical attributes that must be for those types of systems available at every layer. They must be reliable, they must be available, they must be reliable, and they must be secure. And scalable. I think I said reliable twice. So that's important because when you're dealing with healthcare, when you're dealing with defense, or you're dealing with safety and security, those four attributes must be table stakes. But they're hard sometimes in the development and the maintenance complexity. Vantiq makes it easy. The other thing that's unique about it is that it's just like a digital nervous system must sort of be able to exist. I would say think of it as the central nervous system and the peripheral nervous system as being the cloud and the edge. It has to be able to operate and orchestrate at each location. So Vantiq truly is both federated and distributed. Runs on the edge, runs in the cloud, orchestrates activity between the two, can live on-prem, can orchestrate between multiple clouds. So it's really unique in the way that applications can be deployed and the ability to sort of manage those applications and minimize the complexity and shield the developer from that complexity so that they're focused on the business outcomes, in my case, the patient outcomes, and not trying to figure out how do I assemble all these blocks to get to that end state.
So for better understanding, can you share any examples of use cases specifically in healthcare of the technology and solution?
Yeah, absolutely. So we sort of have this tagline, when seconds matter. Mm-hmm. This idea that Vantiq's there for you, it's a trustworthy solution. And so I'll comment initially on the challenge of developing these types of systems. Whether you look at McKinsey or Forbes and their evaluation, when you start to incorporate IoT sensors, when you start to incorporate AI and really edge compute, you're looking at failure rates that sometimes range in the 80%. Thankfully, we have not experienced that, and we've solved for that enormous amount of complexity in a way that allows us to build real-time complex systems and make it easy. So in healthcare, you can think of a broad array of applications. We're really excited about our partnership with a company called OpticX right now, and we're focused on both the commercial and the military space with real-time emergency management response. So imagine a patient in a rural area who's an hour away from a hospital. When a medic shows up, if that patient's having an emergency, we want a number of things to happen. One, we want that medic to be able to connect instantaneously to a clinician. Could be a surgeon, could be a cardiologist, could be a regular emergency medicine management physician to help treat that patient. But we also want to be able to monitor a patient in the back of an ambulance and to create a smart ambulance, so to speak. So if that patient's having to travel 40 or 50 minutes en route to an emergency department, we want a number of things to be able to happen. We want real-time monitoring, real-time decision-making, which may be the use of wearables. It may be actually deploying artificial intelligence in the back of an ambulance to help a medic know that a patient may be at risk of clinical deterioration or having a stroke or a heart attack. We want the receiving physicians to know, where is that ambulance? What's going on? We want them to be able to be better prepared to receive that patient, to know if there's been a change in status, to know as much information as they possibly can so that they're better equipped. And what I'm describing is a very complex real-time orchestration problem. And that's what we're solving with OpticX. What's unique about that is that we can extrapolate that or bring that to the battlefield. You can think of the warfighter on the battlefield and medics responding to those injuries. How do we get enhanced capabilities out to the point of care so that the warfighter has a better chance of surviving or have a better chance of recovering from their injuries, but also that medics are enhanced with more equipped technology that can be real time, but can also run in those distributed or austere environments. So that's one application and use case we're really excited about because we believe we're so uniquely positioned in how we operate and the speed at which we can develop and evolve those applications, that's a market in which we can really make a difference and save lives. Then you look at some of the work we're doing inside the hospital. It's the ability to start connecting multiple devices in a room, including computer vision or camera vision, and we can bring all of this sensor information together and really do two things. We can think of smart rooms, but what we really envision is a day in which a lot of the monitoring of a patient is happening both in real time and without the need for wires, without the need for nurses to continuously come in and take vitals. We want to remove as much of the, I would say, administrative work or change the workflow so that we can deal with staffing shortages or the crises we have, particularly in areas like nursing homes or community living centers, to free them up to better be there for the patient while we can take and utilize technology to do things like monitor patients continuously in real time and monitor that patient, monitor that individual patient, not say, I want to know every time somebody's heart rate is over 100. Well, there may be patients who have conditions in which their heart rate is always over 100 and that's completely normal for them. So it's the ability to sort of have that smart room be precision guided for that patient and to help the system better monitor those patients, better react to situations of interest, and to take a lot of that burden off of the clinicians or the nurses or the support staff to free them up to sort of do more of that direct patient care. So that's another example of where our technology uniquely becomes, I think, appropriate because, again, we get the ability to do real-time sensor fusion, as we call it. We get the ability to do real-time learning. And I think we'll talk a little bit more about our AI and Gen AI capabilities. But it's also the speed at which those applications can be built and deployed. And that brings down both the complexity and the cost of development and the maintenance development or the maintenance cost. So when you're dealing with hospitals that have very low margins, trying to invest in this technology can be incredibly expensive and maybe even cost prohibitive. The other thing I will say about in the hospital that we see is as you start to go to scale and you have all of this data being produced, as clinicians, we really want intelligence. We really want contextualized, relevant information. There may be at points a need to store all of that data, but generally speaking, you don't want that. So why pull all of that data and store it in a cloud where you're wasting cloud compute, you're wasting costs, when I can move compute to data? Instead of data to compute, I can actually do the compute where the data is produced, and that over time will bring down a lot of the computing capabilities I need from a cloud infrastructure. So because of our ability to be so federated and distributed, we really see applications there. The other thing that we're seeing too, and we have a really great project with a company called Trackable Health, but what we're doing is we're really trying to leverage wearables and commercial wearables and bring that information together in a way that's going to enhance wearables to become more than just devices that are telling us about our individual levels of fitness or recovery. But what can that tell us about our overall health, our risk of overall health? The project we have with Trackable Health is with the United States Air Force and working with Deloitte to develop algorithms that can help us better identify readiness at the individual level. So the graying between commercial wearables and medical devices, I think, is going to be something that developers should watch out. But I think the opportunity is that we can have all of this real-time data be telling us a lot about individuals and empowering them, particularly individuals who work in high stress, high risk, or high requirement types of environments, first responders, physicians that work in trauma settings or ICUs, emergency departments, could be even medical students who are going through transitions of different rotations and high levels of stress that may be placed on these individuals. So the ability to use wearables and to gain those insights, we see as a unique, because again, that's an orchestration problem, and that's areas that we solve. So pre-hospital, hospital, wellness, we're seeing a lot of momentum in all of those spaces, and I think it's going to be really exciting to see how all of these proliferate, knowing we were only 6 months into this healthcare journey.
Interesting. You kind of partially answered my next question, but I'm still going to ask it. It's usually one of the most important questions in healthcare. Who are the payers? So I assume hospitals is one example. Who else?
Yeah, so we look at it as it's individuals who are developing these solutions, and we go to market effectively with them. So what I love about my job is that I don't come into these scenarios with developers and come with a predetermined set of answers. There are individuals who are trying to solve problems ranging from pre-hospital to acute to post-hospital. We work with them, and my role is I get to work with them not only to solve the problems that they're tackling, but to help them leverage the technology in the best way. Generally speaking, they have a targeted problem in a market that they've already explored, and what they're looking for now is the technology accompaniment in a way that gives them agility, speed, decreases the complexity on the maintenance, decreases the cost that they're going to need in terms of engineer. So in areas in which you have limited capital or limited cash or limited margins, which a lot of hospitals operate, it's the ability to bring them these really sophisticated solutions that otherwise would have cost them an order of magnitude, sometimes 3 to 4 times. So generally speaking, the payers are going to be the hospital systems themselves, because they see an ability to gain so much efficiency, whether operational or clinical, that they'll recuperate their costs quite immediately. It's also an investment, and it's a long-term investment. They want the agility to grow with the technology. It's individuals that are developing those digital health solutions or platforms. Could be systems integrators that are trying to solve problems for their customers or clients. And so we work sort of with all of those individuals as partners. And that gives us the ability to really think about the unique application of our software, whether it's, again, responding to an emergency in a patient in a rural area or a warfighter on the battlefield, or just monitoring the wellness of an individual to enhance their overall health and the production of their health, so to speak, and this idea of sort of continuous health engagement without this avalanche of data that's necessary to come. So that's sort of who buys and who pays for it. And generally speaking, I think the value proposition for them has been pretty clear. It's a whole lot more cost effective in the long run, and it's sort of an insurance on the reality that the technologies out there are going to evolve and excel at a rate that it's really hard to keep up with. And so we're always ahead of the curve, and we give them that insurance.
So the only thing left is to convince them that it's going to be a cost-effective solution.
That's it. Well, and as every good startup knows, and as every good entrepreneur out there knows, that's the hardest part.
Right.
The most challenging thing, and I think the area in which most people really struggle with, because this is hard, is telling your story. You have to lead with the why. You have to understand that people do not buy in and of itself technology, they buy solutions. In healthcare, they buy end-to-end solutions, complete solutions, certainly unless they're mandated or compelled to buy something. And so you have to be able to tell the story, and you have to be able to tell it in a way that is compelling, that people can understand, they can relate to, that they can see the value that they're going to gain out of it, and that they're willing to make that investment. And that's a challenge. That's a challenge for all startups I see in the digital health space. Is everyone's so compelled, because healthcare is fun, but it's also something that's very compelling. You feel like you're really helping other humans and people when they're either the most vulnerable, when they're sick, or in a state in which you say, look, my solution, my software, my company, my product, whatever it may be, really made a difference in the life of somebody. That feels great. And there's no amount of money that can sort of replace that feeling. But the challenge is because of that, it's a crowded market. It's often very noisy. There's enormous amount of regulatory pressures and financial pressures that sort of fluctuate in and out. There's also the challenge that, particularly within big systems, they want to develop their own. And so how do you break through those barriers, and how do you convince and sort of enter into a market in a way that you have a very compelling story, you meet a very compelling need, and you have a solution to people's problems. And so you're spot on. That's the hardest part. It's convincing people to go with you versus the other.
So recently, one of the announcements Vantiq did about combining generative AI with sensor intelligence, it sounds super intriguing.
Yeah.
Can you tell us more about this?
Yeah, I can. Still trying to wrap my head around how the engineers pulled this off. But the way that I would think about it is you have real-time data that enables the system to generate the prompt that calls the large language model, or in our case, a vector database plus a large language model. We make this super easy, almost drag and drop to develop a vector database, which could be your data, it could be patient information, things that you want to keep both private and secure. And ways in which this is happening is, imagine, and I'll give sort of a real world example for field service. Imagine right now you have a technician, your refrigerator breaks down. Your refrigerator has a bunch of sensors. Your refrigerator breaks down, you call the company, the technician comes out, goes through a few things, has to repair it, and eventually gets repaired. Imagine if I took that manual, the refrigerator manual, I loaded it into a vector database. And then I combined a large language model on top of it, which enabled me to communicate with it. And instead of waiting for the refrigerator to stop working, the refrigerator actually told me something was wrong. It said, hey, this compressor, whatever it may be, is having an issue. Its temperature is out of range. And here's all the things you should do to fix it. And then as you're interacting with it, as you're fixing it, it's talking to you, saying, hey, looks like you fixed the problem, but now I'm seeing this. So imagine that type of interaction, where when we think of what's happening, particularly with AI and predominantly generative AI, it's this relationship. We're fundamentally changing the way that we interact and relate with systems. What our engineers have done has enabled real-time information to continuously be coming to the LLM, so that when you're interacting with it, you're interacting with it in such a way that it feels, in some ways, spooky, but it's real time. And if you change a knob, that information in real time is sent, and so it's communicating based upon that real time data. And so that is a fundamental leap in the way that these applications can be built. And so the use cases here are endless. But it's also this notion that you are really changing the paradigm, where the human isn't sort of asking a question or waiting for an event to happen. It's happening instantaneous. And it's happening in the workflow, and it's happening in a way that this information is surfaced, again, rich, contextualized, situationally aware, and interactive. And so that was our big announcement, plus a couple of other things that are really exciting. The patent pending technology on the ability to minimize, I know they call them hallucinations, but effectively the model getting the answer wrong. There are ways in which we have solved for those problems.
Sounds really fascinating. I can't wait to hear more great news about Vantiq in the near future. Yep. At the very end, traditionally, I ask my guests to give some kind of recommendations to startup founders in digital health. And you already made one about the storytelling, which is really important. Any other pieces of advice you can give? Sure.
So a couple of things I think folks can take away. One of the most important things is to remember at every point in time that it is a journey, and it is going to be difficult. You have to be willing to fail, and to embrace the failures, and to learn from those failures and move forward. And to do that, you need to do a couple of things. You need to surround yourself with a really good support team that is both diverse in experience and diverse in knowledge. Not only does it help your company, not only does it help your product, but it certainly makes, in my experience, the hard times a lot more palatable. Because everyone's unique experience lends some degree of commitment and optimism to what you're doing. And then I believe that it's that sort of camaraderie, it's that team commitment, and it's the diversity of experiences that aren't just going to compel your company forward, but certainly I think make the learning and the journey just that much more exciting. So surround yourself with really smart people who are committed to the same mission you are, but also make sure that there is a degree of diversity, subject matter experts, whether they're in regulatory, clinicians, whoever it may be. I think the other thing that I often tell people is to remember that healthcare is a privilege. And what I mean by that is when you think of clinicians, we get credentialed and privileged. We have a privilege to provide this level of service. When you're in healthcare and you're providing healthcare, whether you're a digital health company, whether you're developing the technology, you're the clinician themselves, it's a privilege. It's a privilege to do what we do. And so there's a lot of things that come with that. So for developers specifically, I always say build with that in mind, which means always go the extra mile to protect their information. To remember that there are challenges with compliance, there are challenges that come with meeting the regulatory standard, but it's also a privilege to do what you do. So as frustrating as those may be, don't cut the corners that are necessary. Put the extra work in because of that privilege of being able to provide healthcare to people. So I think those are a couple of things that I take forward. And then I think the other thing that I've often found is, again, really focus and truly understand, be a student of the problem that you're solving. It just makes you that much better in being able to talk about your why. It also helps you really separate your product and your market position from others, is to really be a student of the problem that you're solving and really truly understand it. Sometimes that means your company will evolve. Sometimes it means that your product positioning or your marketing positioning will evolve because the problem has evolved. A regulatory change has come down that has changed what you initially were trying to solve. So again, I think it goes back to being sort of a student of the game, and really being sort of focused on that problem and seeing the evolution of that, and then being willing to evolve your product or your company to really continuously solve that problem.
This is really great. Thank you, Ryan, and good luck with your new chapter.
Thank you. Appreciate it. Thanks for having me on.
Thank you.